is the Emergency Medical Minute.
Okay, I'm going to talk to you a little bit about predicting outcome for head injuries. Ouch, I hurt my head. We always use Glasgow Coma Scale, but it's not always the best predictor of outcome. We see a lot of traumatic brain injuries here, so it has some import for us in terms of expectations for our patients. There are two really huge studies in neurosurgery that look at brain injuries. One is called IMPACT and the other is called CRASH. We have about 16,000 patients between the two studies. And some researchers extracted the data from that, and they looked at Glasgow Coma Scales and how well it predicted outcome. As it turns out, curiously, as you drop down, not curiously, your outcome is worse, except when you get to about 4. When you're 4, it's the worst it can be, despite the worst Glasgow Coma Scale, which is 3. So actually 3s do better than 4s. So they wanted to try, why was this the case? So I took and looked at some other data, including pupil response. And what the researchers found, if you take the Glasgow Coma Scale and subtract the number of non-reactive pupils in the patient, you get a GCS-P score that instead of the lowest number could be 3, is now 1. So if you have no non-reactive pupils, you don't have any change in your GCS-P score. If you have 1 blown pupil, it's 1 less, and if you have 2 non-reactive pupils, it's 2 less. And they found that was a better predictor for long-term outcome in that patients who had a GCS-3 had about a 50% mortality and a 70% poor outcome at 6 months. But if you took the GCS-P and subtract either 1 or 2, when you get down to 1, you have a mortality of about 74% and a bad outcome of 6 months at about 90%. So you would predict that people would do worse when they get their scores lower, but it actually is a better marker for people looking long term. So it's a GCS, which we're all used to, minus the number of non-reactive pupils to give a more accurate outcome for both mortality and 6-month poor outcome.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.